It's ding ding, two men in a ring. We put pride in your stride and a quiver in your liver. You want 'em, we've got 'em, coming to you. Loud and proud, he's the biggest, he's the baddest. It's Mr. Gavin Davis on the Gavin Davis Podcast Show.
Good evening, everyone, and welcome to another edition of the Gavin Davis Podcast with me and my co-host, Mr. Dave Bruff. So it's introduction time with tonight's guest. He is a recognized concussion specialist. He provides expert and independent assessments in real-time sporting events to identify and treat brain injuries. He is a senior neurosurgeon, registrar, and member of the Royal College of Surgeons England. He is dedicated to improving diagnosis, treatment, and awareness of concussion and brain injuries. He is also committed to using his research and clinical expertise to drive positive change in the area. Me and Dave want to welcome to the podcast Mr. Tom Grundy. Tom, welcome, mate.
Thanks very much for having me.
No, thank you for coming on, mate. We've had a lot of interest on this podcast the last 2 days, so it's an honor to have you on. So thanks for sharing any intel that you've got with us.
Oh, great. I'm very happy to help.
Okay, so what we're going to do, we're going to go straight into it. Question number one. I want to know, what is a concussion and what happens in general terms to the brain after a trauma?
Oh, that's a really good question. I mean, the term concussion is still being debated, I guess, when we consider concussion in the context of sport. There are a number of consensus meetings that are still happening every couple of years to try and pin down exactly what we would call concussion. But essentially, we can think about it as the set of symptoms that a player or a patient suffers after they've had an impact to the brain sufficient to cause an injury. So another way of describing concussion is to call it a mild traumatic brain injury. And if you think about what's happening after a head collides with an object, let's say, there is movement of the brain inside of the skull. So as the brain is moving and then it stops as it hits an object, the brain is moving around inside the skull to a degree. And not only is it moving inside the skull, it's moving inside itself as well. It's rocking about. And when that happens, the brain cells and the cells that are supporting them deform, they bend out of shape. And we think that somewhere in that process, damage is happening. What that damage looks like are the symptoms that we end up with, the symptoms that often people will report: headache, dizziness, sometimes feeling sick, sometimes problems with memory, sleeplessness, restlessness, and mood changes. Thankfully, concussion is often short-lived and doesn't require a great deal in the way of treatment, but in the context of sport, actually needs some serious thinking about, because it's an injury to the brain, not just a bump on the head, which I guess we can sometimes be tempted to call it.
Okay, mate. I'm going to bring Dave in, because I know Dave's got some questions to share with you as well.
Hi, Tom. On one of the earlier podcasts, Gavin and myself were discussing one of the differences in the combat sports. You have, for example, in MMA, you have fighters wearing small gloves that, I guess, protect the knuckles, but the impacts to the opponent are quite heavy and you can get a knockout potentially quite early, compared to a boxing scenario where you've got bigger gloves and you can have an opponent sustaining non-knockout blows for up to 12 rounds. What's the more damaging to the brain if it's known? A knockout after a couple of heavy concussive blows, or smaller but more numerous strikes over a prolonged period of time?
Sure, it's an interesting question. I think the question about gloves generally, we could maybe think about gloves being an area of like a deceleration or buffer zone as contact is made with the head or the face, let's say. As the fist continues to move inside of the glove, if there is more padding there, then I guess it might stand to reason that there is an element of deceleration that is happening, which theoretically, I suppose, could reduce the amount of force being transferred to the skull and then to the brain as the brain then moves around and undergoes injury. That said, I don't think there have been any significant studies that I'm aware of about the effects of gloved hands and the difference between a sort of light wrap or a light glove compared to a heavy one. However, the question about which would be more damaging is an interesting one. The bottom line is we don't really know, but some principles that might guide us. We know that repeated impact, repeated head injuries, certainly repeated episodes of concussion, often alter the threshold for further injury down the way. So sometimes, if I can take rugby as an example, when we recognise that a player has had an impact to the head, there are protocols now in the sort of elite level of sport to try and reduce the risk of a second impact or a second injury in the same sitting. And the purpose of that is to try and limit these small stacks of injuries that you can get on top of one another. And there is a phenomenon called second impact syndrome, which is thankfully very rare, but can have quite catastrophic consequences, where an injury happens to the brain, and then in very short succession, another injury happens, and a runaway cascade of, we think, swelling, amongst other things, goes on, which can lead to ultimately a loss of life. And like I say, thankfully, that's very rare. To come back to your question then about small repeated blows versus one large one, it might stand to reason that small repeated blows long term might be worse for you, and you might well receive more of them over a period of a boxing match or a fight, versus one or two large hits, which means the fight is over quite quickly. And so while I don't think any of these impacts are necessarily great for your brain, if I had to pick, I think I'd pick one big or two big blows to my brain rather than a number of small, less padded ones. The honest answer is there's no good test. No one's got ethics yet to be able to punch someone in the head and see the difference, rightly or wrongly.
Yeah.
Can I just, sorry, Gab, can I just
No,
follow?
go on.
I've just had a random thought, Tom. Just given the nature of some of the research that's happening around what you're doing, and you mentioned second impact syndrome, which is very rare, and that's when a concussed brain receives a second impact. Does that impact have to be a strike? I mean, what happens if a concussed person was to suffer an infection that caused a response that affected the brain? Is there anything known around that?
Sure. I mean, the context of second impact syndrome normally speaks about, or normally refers to, traumatic injuries that are very close together in time. So normally, if we're looking in the context of sport, we're talking about the same match, the same fight, the same contest. So a matter of minutes to hour between injuries. So the chances of an insult in the sense of infection, it's not something I know of any research about. The principles that underlie some of the injuries that we know happen in the brain can be driven by inflammation, of which I guess infection is part and parcel of, right? So it stands to reason that that's perfectly possible. But when we talk about second impact syndrome, most of the time we're talking about another traumatic injury close to the first one in time.
Okay, so the next question that I've got is something which is quite close to my heart, because when I was fighting and I was training MMA, I would be, for example, training on a Wednesday night and we'd be sparring, and I'd be coming home after the sparring, and normally, because I was only 60 kilo, if you were sparring with 70, 80, 90 kilo lads, I always found that if you were sparring with someone the same weight as me, taking a shot was totally different than sparring with someone who had 20, 30 kilos on me. And I'd be coming home, I'd be getting in the bath, my head would be banging. So obviously from what you're saying and just a bit of common sense as well, I've sustained an injury there. What my question leads on to is, how long should I have been resting before going back to train? Because I would have been back training the next day. On the Thursday, I would have been doing jiu-jitsu, so I wouldn't have been sparring, but I'd have been sparring on the Saturday.
Okay. I mean, that's it. It's a good question, and it's a question that we in contact sports are always trying to answer that question. When someone has been diagnosed with a concussion by whatever tool or metric we use to say, yes, this person has unfortunately suffered a traumatic brain injury and they've got the symptoms of concussion. In a lot of sports now, the regulations and frameworks that have been put in place are there to try and mean that you don't participate in that sport again until you've completely healed from your brain injury. And actually, that's quite an arduous process to say, okay, well, you come home today with a headache. Has that resolved by tomorrow? Is it carrying on for 2-3 weeks? And the best guess we have is to say, for example, if I use rugby again as an example, there are some rugby governing bodies that suggest 10 days or 11 or 12 days before you should return to contact training. And that is born out of our best guess as to when a concussion is resolved. The treatment of a concussion is actually quite a passive process on the surface of it. And you can accelerate or change the way in which your recovery goes from concussion by taking active steps to limit the amount of load to your body and brain. So often we suggest to athletes that they should rest for at least, say, the first 24, 48 hours following a concussion. So it's physical and cognitive rest is what we try and get athletes to do. Very hard to do because athletes, like I'm sure you know, want to go out and do things. They're actually pretty rubbish at sitting at home and doing nothing. But in those periods of time, if people who are watching this podcast are worried that they might have had a concussion, the advice would be rest as much as you can for the first 24, 48 hours, and limit the amount of phone time and screen time that you have in that time. What you want to try and do is allow the brain a chance to rest before you return to physical activity. What we don't know is that when you go back to training the next day, which you obviously have done before, Gavin, are you at a significant risk of developing a second injury or a second concussion? We don't know that for certain, but our best guess is that you are at a bigger risk or a greater risk of having a more severe concussion where the symptoms can last for longer. That's what the evidence suggests, but that's as far as we can really say with certainty.
Okay, mate.
So
Dave, you want to come in, mate?
So after the brain suffered a concussion and there's been damage, do we know how that alters, even after it's recovered? Is the brain the same? And does it respond to subsequent injuries differently?
Sure. So when an athlete, say at the beginning of their career, is starting off, their first concussion is a new experience for them. They don't know it. They just know that they feel pretty terrible with a whole set of symptoms after a head injury of some kind. And maybe we can talk about the different kinds of head injury and what's more likely to cause a concussion. But once they have recovered and they've gone back to their sport that they love and they like doing, the next time they get a concussion, two things really happen. One is that they are more likely to recognize that they've got symptoms and they tend to modify their behaviors a little bit. But secondly, they tend to report, and athletes tell us this time and time again, that their symptoms are often a bit more severe. So whereas they may have had mild headache the first time, they might classify it as moderate or even sometimes severe on the second, third, fourth, fifth concussion. We don't know whether that is because there is more damage, worse damage, the more times you get concussed. But there is a definite trend in the objective and subjective scoring of athletes. Once they've suffered serial concussions, that their concussion symptoms are often worse and their recovery times can be longer. And that suggests, when you think about it from a sort of underlying biological principle, if these symptoms are born out of injury, that the injury is either worse or is healing less effectively each time. You asked about what is the injury, and that's a question that we're trying to answer with some of the research that's ongoing in the field now, some of the research, for example, that I'm involved in. If Gavin got concussed tomorrow when he's training, we could put him in a scanner. We could put him in one of the best scanners that we have in the medical field using the techniques that we currently have available to us. And we would probably find a pretty normal looking brain. So the structure of the brain on first glance, on initial set of imaging, would probably look exactly how it does in a non-concussed state. And so we don't think that there is a big structural problem that happens after concussion. Our best guess, or what the science that we've got available to us suggests, is that there's probably damage in the way your brain is connecting into different parts of itself, the way it is communicating with itself, and the way that the cells that support the brain cells are interacting with one another. And so in many ways, it's good that we can't see injury to the brain, injury with our own eyes or injury on a scan. But in other ways, it raises a whole other question. What's really going on in there? And how can we then fix it or help it to heal quicker or help it to heal on its own better?
Yeah. Well, that was a big part of the reason that I knocked it on the head at 30, the MMA, because I took some shots, and like I've spoke to Dave, I've spoke to a number of people about this, where, you know, there was a fight I had in Wrexham years ago, and I got caught with a knee.
Right.
And for about 6 seconds of that fight, after that knee, I don't remember any of it. When you watch the video back, you know, I'm grappling, I'm on the floor grappling. But there's a period there where I'm totally just knocked out practically. So I always had it in the back of my mind as I got older that there's only so many shots you can take. And I stopped quite young. I stopped at 30. I just concentrate on my jiu-jitsu now. But I think this is so interesting, because I know the shots that I took, and I know other people. And I'm not going to mention names on the podcast, but I know people who have fought a lot longer than me, who have then got symptoms of being punch drunk through a career of taking shots.
Yeah, it's a real concern. And, you know, when we speak to athletes that have been through their career and are feeling maybe that they're more towards the end of the career, or that aspect of their career, their focus often now, if they're in contact sport, is, I wonder if I've done myself any damage. Am I still doing myself damage by carrying on? And it's alarming to hear it, right? When we sit there and we talk to athletes in the clinic about their risk, their lifetime risk. It's stories like you mentioned there, Gavin, when they can't recall certain parts of a fight or of a match that they were playing that they were enjoying. And some of the athletes we speak to say, this was a massive deal for me. You know, this was the pinnacle of my career, and there are parts of that 60 minutes that I played that I just can't recall. And it's alarming. And I guess after any kind of head injury, whether it's in sport, whether it's in an unfortunate car accident that happens down the road, a degree of amnesia, a degree of memory impairment is quite common as a one-off episode. We see it quite a lot, that people struggle to remember what happened just before and sometimes just after the injury. But it's when that becomes an established pattern that becomes a bigger concern for us as doctors and as support staff for athletes that are trying to make sure that we keep you guys as healthy as we can and as safe as we can, while sometimes doing stuff that might not sound that safe, like MMA fighting or throwing yourself at another rugby player or heading a ball, 600,000 times in a career.
Just before we move on, I just want to touch on something you said a couple of minutes ago, the different types of brain injuries and the different types of impacts. Can you just touch on them for us, please, Tom?
Yeah, so if you take any contact sport, you will find that there are a number of impacts that could result in head or brain injury. So if you're in a fight, for example, you mentioned MMA, you took a knee to the head. And in other contact sports, rugby is a good example, you can find a head-to-head clash, you can find a head-to-shoulder, head-to-hip. And sometimes actually you can see no head contact, but still detect a brain injury when you assess these athletes. And actually, that's something that a lot of athletes tend not to realize at first. They'll say, "Doc, you never touched my head. My head never got a knock. Why do I feel so bad? Why are you telling me I'm concussed?" And actually, there are some impacts that are more forgiving than others. So heads to hips, heads to knees, pretty unforgiving. These are pretty solid joints that don't move very easily. Heads to heads are actually pretty unforgiving as well. And in rugby union have been shown to be one of the most concussive types of injury. The whiplash injury, which is, I guess, maybe more applicable to some of the sports that you guys talk about and that you guys think about, where actually the body is, say, making contact with a mat and is stopping and decelerating pretty quickly. Although the head may never touch the mat or may never touch the wall, the head is still decelerating inside of the skull. The brain is still moving, and the cells that are supporting the brain cells are still deforming, bending out of shape and coming back. And we think that one of the reasons this happens, or that we see this as often as we do, is because actually you might have repeated episodes of that in a fight or in a match or whatever reason, because they often slip through the net, they're often undetected. And so it's the job of people like me and other sort of pitch side or ringside clinicians to be vigilant and look out for those and say, okay, that happened 20 minutes ago, and now we've got this set of symptoms or this set of signs. Do we need to put these two things together and say, has a brain injury happened here?
Okay, so when we look at like PPE and protecting our athletes, one thing that's always kind of been about is head guards in martial arts and in boxing. And then there's been like a phase where they stopped using head guards, and then head guards have come back in the last 5-10 years for protection purposes. I always hated having a head guard on because I found it used to drop down over my eyes, and then I couldn't see the punches coming. Let's talk about PPE, head guards, and are the risks of head trauma still there with head guards on?
Yeah, it's a funny old thing, isn't it, that head guards came into being in a lot of sports and then were shuffled out and then have started to re-emerge in some sports again. When you think about it intuitively, you would think that putting something on your head that might help limit or mitigate an impact would be a good thing. There were a couple of studies in a couple of different sports that suggested actually they didn't really do very much to decelerate you. So if you're about to take an impact on your head, a bit like with the gloves, there's a small amount of padding there that might help decelerate your fist coming into contact with your head and subsequently then your brain, and that some padding there might help. The feeling was, when they analysed those impacts, that actually there wasn't very much in the way of deceleration there. There wasn't very much added benefit. And in fact, there was some evidence that people who had head guards on took more risks because they felt protected. There are also some other bits about it, like you mentioned, Gavin, that sometimes these bits of PPE that we wear are uncomfortable or impact our performance in a way that then means you might well end up suffering more head impacts. And so they came out of fashion for a while. The reason sometimes that these things then come back into fashion is that technology does move on. You can get actually some pretty interesting smart materials that can help with deceleration more now than they could when it was just a bit of essentially stuffing in a bit of plastic. And also we can instrument these guards now. So in the helmets of American football players, they often now have accelerometers, these small devices that can tell you how much the head is moving and can give you an approximation of the amount of forces that are going through your head. And they can actually model some of the G-forces that are moving around your brain. And so while they might not be protecting you a great deal from impact still, what they are doing is giving you real-time information about the load that is going into your brain. So I think still largely these bits of PPE, certainly head guards, are about keeping athletes pretty, minimizing blood injury to the face and things like that. And they certainly have a role there. But I'm not convinced yet that there's good evidence they're reducing rates of concussion. And I don't think that's borne out in the evidence, in the science that we've got at the moment. But I think it's an area where we as a community of people interested in trying to keep people safe in sport can really build on. There are now mouth guards that you can have in, and I know that they've been done in MMA, that can not only protect your teeth, but in the same way as the helmets we just discussed before, can measure the amount of acceleration and deceleration that your head has, and as such, your brain has. And you can monitor that load over a period of a career if you wanted to, or a year or two, and know how much exposure you'd had, which I think is exciting.
Yeah, it's amazing, really good.
I want to, if it's possible, can we go back to the non-direct impact, so like the whiplash type injury? Because in some types of jiu-jitsu, like so the typical British jiu-jitsu or in judo, you have there's a lot of throwing, so you're maybe your impacts are maybe falling from 3 foot, 4 foot high with acceleration as somebody throws you onto a mat. And I've been in classes where you've done that the whole class, or you've been in lineups hitting the mat quite heavy. I don't train like that now. I use a crash mat. But I'm just, what do you the long-term impact or the long-term effect of repeated throwing, that kind of whiplash injury, is that likely to be as significant as a strike or repeated strikes?
It's a good question. I think the idea of a whiplash injury, the reason, like I alluded to before, that we are wary of it is because often it is dismissed as a, well, nothing's hit my head and therefore I'm probably okay. This headache's probably from something else. I might be dehydrated. I might be this. The light's irritating my eyes, but actually, X, Y, Z. So in terms of repeating those small regular blows that might not even result in any symptoms that you might notice on a sort of day-to-day, I think that's where the danger lies in there. The brain will certainly be deforming. It will be, the skull will be moving, the brain will be moving within it. And often in those rotational movements that you're describing, you don't just have the brain moving back and forth or side to side. Alarmingly, you actually get a rotational movement in it as well. What we know about brain injury in the more severe ends, in the moderate to severe brain injury rather than concussion, is that this rotating movement is often the bit that causes damage to the axons, to the brain cells that are spread throughout your brain, because they're a bit like a mesh. And if you tear that mesh, the connections are often interrupted. So in terms of trying to understand that risk when you're practicing sport, I think it's about there'll be times when you'll know that you've had a big hit and everyone around you goes, oh, and actually they're the ones you ought to maybe be less alarmed about, because you know about those and you tend to modify your behavior for a little while afterwards. You tend to be a bit more cautious. You tend to tense your neck as you're being thrown or expecting an impact. It's the ones that you're not expecting or that don't look so severe on first view that might well be building up your chances of having an injury. So in other sports, there are exercises particularly focusing on neck strength to try and reduce the risk of a whiplash injury. So of an acceleration, deceleration injury without any head impact. I come back to rugby union because they have quite a good governance structure around how they try and prepare their athletes for these types of injuries, and neck strengthening exercises are a key part of that, as well as thinking about how they can position their bodies and brace themselves for an impact, whether that be a whiplash impact or a direct impact. And at the top end of sport, my belief is that's where we should be in nearly every sport. We should be saying to athletes, we know that this particular movement might result in a whiplash injury or a head injury. These are the things you can do to limit your head movement and subsequently your brain movement.
So that's really interesting, because I can tell you in dojos all over the world, there's people taking these types of injuries. And in some jiu-jitsu styles, what happens before they get thrown, and they do this repeatedly, there'll be a strike potentially. So you might have an initial strike and then that kind of rotational injury as well. And this is a very repetitive action. So I think that's maybe something that we need to look more closely at. Yeah, that's very interesting. That's why I think in terms of, and we've talked in the past about longevity, and one of the things I've taken from judo, the judo clubs I train at, is when we're doing lots of throws, we're doing it on crash mats. So the only time I'm actually taking an impact in judo is when I'm doing a randori or free practice, and I get thrown, but it's only once. It's limited.
Yeah, and I think, you as an individual practicing those sports definitely have a role to play in understanding your risk, but actually governing bodies, whether that's at the elite level of a sport or whether it's at the community level of a sport, are recognizing now that they need to be upfront with the people that practice those sports in trying to explain where the areas of risk are, where the areas that you can mitigate those risks, and how you can make training and practice as safe as you can, so that when you practice the sport live, if you like, for real, when you're not training, actually that's when you can't really mitigate the risk so much. And so you're accepting that part of risk so that you can then, the rest of the time when you're training, limit those risks. And I think it's for governing bodies to try and lead on that, and individuals then to try and take that responsibility.
Yeah, I think I'm glad you said that, Tom, really, about mitigating risks, because listening to this podcast, I don't want people to think that, oh, we shouldn't be doing this and we shouldn't be doing that, and like pushing people away from martial arts or pushing people away from boxing or anything like that. What we want to do is make them aware of danger, and actually allow people to train safer in a better environment so that they can get more longevity. Because I know what martial arts has done for my life and everything it's given me, and I'm grateful to martial arts. I'm grateful to MMA, and I absolutely love the sport. Same with Brazilian jiu-jitsu and jiu-jitsu. So I'm glad you made that point. It's a very, very important point, mate.
I think you're dead right. What we don't ever want is to say to people, well, exercise we keep telling you is really good for you. Stop doing it because we don't think it's good for you.
Yeah.
There are, even if you just take the sort of physiological aspects of training and all the parts that go with maintaining a healthy body, there is so much else to sport, especially the sports that you've described, that enrich your life. And when we give messaging about this, when we talk about brain injury and concussion and lifetime risk, it can sound pretty scary, right? I would be pretty scared sometimes if I was sat in the clinic listening to me speak. But actually, we have to accept those risks, know about them, and then do the things we love, right? Do the things that make us feel good. And it's about trying to find that balance. It can be really difficult.
Yeah. So we've talked about throws. We've talked about strikes. Let's talk about chokes in primarily a jiu-jitsu contest, more of a Brazilian jiu-jitsu environment. So I was up training with Dave last week, and actually we had a bad one on the mat. It's quite rare. I had a lad rolling with me, put a collar choke on him. He was pushing into the choke, quite a novice thing to do. And he went to sleep. I put him on his back. I put his legs up in the air to get some blood back to the top half of his body. And he was probably out for about 6-7 seconds. He came round. He didn't even know he had been asleep. Didn't even know. And then he wanted to start rolling again. And I was like, no, stop there. You've just been knocked out. That's you done for the night now. You're finished. Okay. sit there, have a rest. You're not doing no more, okay? But he didn't even know. So can we talk about the effects of getting choked in that environment can potentially have on the brain as well? Because I'd imagine, tell me if I'm wrong, I imagine it's different than a concussion.
Yeah, I think you're right. I think it probably is different to a concussion. I think what we don't have in that choke is any mechanical movement of the brain, right? What we're probably looking at when we're thinking about a choke or a strangle or a hold in that manner is probably limiting the amount of blood flow that's getting up into the head and actually out of the head. To compress a vein in the neck is relatively easy.
Yeah.
To compress an artery, actually, you've got to put quite a lot of force across the neck, but it's entirely doable. And in athletes like yourself, very easily doable if you apply the right strength in the right location. When people lose consciousness, and this can be for nearly any cause of loss of consciousness, often it's as a protective measure. The brain is actually doing it to try and limit the amount of injury it then has as a result. So if you think about someone who's got very low blood pressure, there's not much blood getting to their head, delivering the oxygen and the nutrition that it needs, and you're stood upright, often when people faint, they lay on their back or they lay horizontal and more blood gets to their brain. And it's a way often of the brain trying to restore blood flow or oxygen delivery. And so the actual loss of consciousness that you describe, I mean, it sounds alarming, right? And in many ways it sort of is, but it is probably the brain's way of, one, limiting the amount of work it needs to do, the metabolism of the brain, by shutting down a bit temporarily. And two, often it stops whatever behavior is making the problem in the first place. So in this case, it would be, fighting against a choke or a hold.
Yeah.
You then stop doing that. Blood is then returned to the brain, and hopefully the brain comes back into its normal function pretty quickly, which it sounds like it did in this case.
Yeah.
I think if that loss of consciousness is short, transient, and doesn't leave any significant symptoms behind, actually the brain can probably tolerate that relatively well, in so much as it's lacked something for a few seconds and then it gets it back pretty quickly. So in a young, healthy athlete, I'm not sure we can compare that directly to a concussion. And I'm not sure we could say with certainty that it's causing any long-term or lasting damage. I think if participants or athletes are unconscious for a longer period of time, more than a few seconds, that's when you will start to agitate the ringside doctor or healthcare professional, because actually that's probably a sign that there has been some injury somewhere along that line. The brain has been without oxygen for longer than it would normally like. And that's normally, I think, a sign, if that was a repeated pattern, that something needs to change in the way either the athlete is engaging with the sport or the sport itself maybe is taking a larger toll on the brain.
Okay.
But ischemia, this idea of not getting enough blood flow, could well interact with mechanical injury. So let's say the example you gave, Gavin, of the person you had in a hold earlier this week, if they then went on to continue to train that night and suffered a mechanical impact, the concern there would be that the brain has already had one small insult and then we're adding another one on top. And so yeah, I think you were right to give the advice that you did, which is actually, you've probably had enough for tonight. Let's train again tomorrow. Even if they're feeling good, even if they're feeling well.
Yeah.
I think it's hard to justify jumping back onto the mat and getting going again, at least without a little break.
Yeah. I wouldn't have let him carry on. One thing just before we move on, I pass you back on to Dave. There's one more question I want to ask you on this topic, okay? And it's quite an interesting one. And there's been a lot of debate online with regards to it from a Brazilian Jiu-Jitsu point of view. So when people they don't tap and they get knocked out from a choke, and then they get put on their back. A lot of people put the legs up. Now, I've always been told to put the legs up to get the blood flow back towards the head as quickly as possible. Would you say that's the correct thing to do, or is there something better to do?
Sure. I mean, I think if there is, if the athlete is lay on the ground, they're probably actually within a few minutes within a few seconds, going to get the normal blood flow back to their brain.
Right.
What you're doing when you're lifting the legs into the air is you're actually taking most of the blood that is sat in the legs, mostly in the veins of the legs, and returning it to the heart.
Yeah.
And the heart, provided it's healthy and normal, will then get the blood to wherever it needs to be. So what I don't think you're doing there really is harming the participant's brain. I suspect that if you didn't do it, the athlete would come around in a similar time anyway.
Okay.
If athletes are unconscious for more than a few seconds, the recovery position is definitely the position they should be in. So often that's on their side, and it's to hold the airway open while they're recovering. And the blood will get to where it needs to be, assuming that the heart is beating and beating normally, which hopefully all of the time it is.
Yeah, I just wanted to pick your brains on it because some people say to do it and some people say don't do it. So, right, I'll pass you back on to Dave, mate.
Just to follow on that point of chokes, I have read some jiu-jitsu teachers suggest when they're training going for chokes and strangles as the safest way of winning contests, because they think there's probably no studies done, but they would know of, but that there's no lasting damage to the opponent. So you're not breaking their arm or damaging their joints. They're either going to tap or they're going to pass out, but either way, it's going to be a temporary and transient kind of insult to them. Just to kind of summarize, I guess, all of these types of injuries, Tom, what are the consequences in longer term life or older age of repeated concussions?
Great question. I mean, Gavin alluded to it before, right? He mentioned the term punch drunk, which some viewers of this podcast might be familiar with, some athletes might be familiar with, but it was been described for a very long time in the literature. It was often used to describe boxers who'd had repeated injuries over a period of time and then were behaving in an unusual manner in their middle years. The situation was often clouded by other factors like alcohol and substance misuse, and so these athletes or ex-athletes were often thought of as demented or drunkards or both. And actually what they were probably describing without really knowing it was CTE, chronic traumatic encephalopathy. We don't know that for certain because they didn't have autopsies and scans in quite the same way that we do now. But that concept has been around for a while. And really, when we talk about concussion specialists and concussion monitoring and head impact monitoring and mild traumatic brain injury treatments, what we're trying to do is limit the risk of that, because that's the place you don't want to be and the place you are now. We want to break the line between those 2 points. We know that American athletes, American football athletes, there is a tendency towards having this set of symptoms that when they pass away and we look at their brains, we can diagnose CTE, chronic traumatic encephalopathy.
A lot of pro wrestlers as well. A lot of professional wrestlers suffer with it.
Yeah, I think you're right there. There are a lot of sports that are seeing these trends in the athletes that used to practice 10, 20, 30 years ago. American football has by far been the most vocal about it, and you might argue rightly so. But we can only really diagnose CTE for definite when someone has passed away, when we can physically look at the brain, cut it into some slices, and see it in its raw form. But there are more and more techniques that we can use to be able to look at the brain while it's still inside the skull, while you're still walking around and talking, that might suggest CTE is happening. But at the moment, we can only really say it's probable CTE. I won't tip into the detail of it too much, but the underlying, I guess, thing that we think is happening in the brain is that it is getting injured, it's getting inflamed, swollen, upset, however you want to call it, after a head injury, or actually a series of brain injuries over a career. And probably in the process of healing, the brain is depositing these proteins, p-tau proteins for detail, in the areas around the brain cells. And over a period of time, these proteins build up and stop the brain cells communicating in the way they ought to. And that can lead to some pretty upsetting consequences for athletes themselves, and actually for the people around athletes, the people that love them the most. And so that's why we, as a medical community in this area and in a research community in this area, and athletes themselves, are all worried about repeated head injury, because that's where it can end up. I guess it is worth saying that not everybody who has, a multitude of head injuries over the course of their career or their amateur career or their professional career end up with CTE. There appears to be some populations, some people that are more prone to it. And there's no way of predicting whether that's me, whether that's you, or whether that's the person walking down the street just now. But you only get one brain in many ways. In every way, you only have one brain. And so what we've got to try and do is look after it as best we can while still living a life, doing the things that we love. That's the real challenge for brain injury in the long term, when you consider young people starting their amateur careers in, MMA, in rugby, in football, in judo, and then how we can counsel them so that they never get to that point of CTE, or to that point where they've lost 5 or 6 seconds in an MMA fight. And it's a challenge.
Yeah. Looking at the CTE, because I was a massive pro wrestling fan back in the day, and I know that there's been a lot of debate linked in with the American football as well about how that links into depression and, like you said, alcoholism. Is there any research with that people start getting depression and that?
Yeah, so there are some studies ongoing now in athletes who've suffered multiple concussive injuries that's going prospectively. So they know that these people have had injuries, and they're now engaged in sort of mood and mental health monitoring over a period of years if they want to participate. Likewise, when we see patients who've got a diagnosis of CTE after they've passed away, if you speak to their relatives and the people that know them well, they will often describe that these people have had low mood, increased suicidal ideation, so not wanting to be here anymore, often problems with alcohol and drug misuse that might have nothing to do with it, but also might well have something to do with it. In all aspects of dementia and those types of conditions, we often see mood changes, and depression and low mood is one of the most common. But also anxiety is a big driver, a big psychological driver for a lot of the behaviors we see in dementia. And in athletes especially, you might not think on the surface of it that athletes would be particularly anxious people. They often are. They're often anxious about a whole load of things: their performance, their perceived standing in the sport, how they're going to make a living, how they're going to support a family. They're often quite anxiety-driven people. And when they go on to suffer these symptoms that are consistent with CTE, that anxiety is often the very first thing that gets worse, followed by memory, followed by low mood, so on and so forth. And so there's a lot to unpick there. Yeah. And really what we need are athletes to come with us, right, on this journey, to go, okay, well, this is the exposure I've had in my career. And yeah, I'm happy to participate once a year in a telephone screening to see if I've got low mood or to see if I've got memory problems, because that's the only way we'll build up that picture, really.
Okay, mate. some absolutely fantastic content there and some knowledge. Really, really impressed with that. Thank you, Tom. Dave, is there anything that you want to ask Tom before we start bringing the podcast to a close, mate?
No, I think we've covered a huge amount there, and thank you very much, Tom. Some really insightful stuff.
Oh, you're very welcome. Thanks very much for having me. It's great to be able to talk to two people that know sports really well in this area, and that think that brain injury or concussion is something that we should take seriously.
Oh, definitely. Tom, thanks for coming on, mate. It's been an absolute privilege having you on and just picking your brains on all that information we've just had the last hour. Absolutely incredible. So thank you very much.
Very welcome. Thank you.
Okay. Good night, everyone.
There's a brand new podcast on the scene talking all things martial arts. If you've never seen a podcast, it's a brilliant place to start. So like, subscribe or download to the best thing on the net. Yes, he really is that tiny. Please do not adjust your set. You can watch it on your telly. You can listen on the go. Tell all your friends and family. Tell everyone you know. Feel free to leave a comment. Tune in, give us a share. The only host that I know gets his keys from Build-A-Bear. The Gavin Davis Podcast. The Gavin Davis Podcast. Jump on board, we'll have a real blast on the Gavin Davis Podcast. A captivating podcast streaming straight into your house. He's a little pocket rocket. He's the Welshman's mighty mouse. Great guests and conversations that won't bore you to tears. Thank God he's wearing headphones to hide those grapplers' ears. Gavin Davis Podcast.